I'd like to thank you all for attending the first institutional grand rounds. And I'd like to identify the people that possibly made all this come together. First of all, Sanjay Junja, who is a resident and fellow here at LSU, and the president of the Resident Council, the Institutional Review Committee for LSU, and the members of that are Paul Cooper, the Program Director for Pediatrics, Luke Baudouin, the Program Director for Family Medicine, James Morris, who is the Program Director for Gastroenterology, Catherine Richardson, the Program Director of Surgery, Marianne Edens, the Program Director of Emergency Medicine, Timothy Leanne, the Program Director for the ENT program, Russell Cruz, who is my, I don't know, I guess he's my sidekick and has been for about 14 years, and I really appreciate all the work he does. And also our interim dean, Dr. John Marymont. He plays two roles, the interim dean of LSU, as well as the department chairman of orthopedic surgery. He is hopefully having much better weather than we are. He's on vacation or would be here to introduce you himself today. Our first speaker for today is Dr. Steen Trawick, Jr. He's the Regional Medical Director for Sound Inpatient Physicians and an internal medicine hospitalist. He's a native of Monroe, Louisiana, and graduate of Louisiana Tech University in Ruston. Dr. Trawick has lived in Shreveport since attending and graduating from LSU Health Sciences Center here in Shreveport, where he also completed his residency in internal medicine and pediatrics. Dr. Trawick is on staff at LSU Health Sciences Center, Shreveport, in the departments of internal medicine and pediatrics, as well as the Department of Allied Health. In addition to his staff responsibilities, he regularly lectures the physician assistant students. He's active in local and state medical politics. He has served as past president of Shreveport Medical Society, serves as a member of the Governor's Advisory Board for Physician Assistants, and is a member of the Council on Legislation, Vice Speaker of the House of Delegates, and Chairman of the Budget and Finance Committee for the Louisiana State Medical Society. He is a former member of the LSU Board of Supervisors and Louisiana State Board of Regents. As a primary care physician, he is an advocate for the health of patients and takes a special interest in the treatment of diabetes mellitus, exercise, and lifestyle modification for patients. He's also an avid runner, and he's completed 10 marathons. He's a Sunday school teacher at Summer Grove Baptist Church here in Shreveport. He's married to Rhonda, and they have two children, Allison Grace, who's 14, and Graham, who's 12. His interests are family-centered, including traveling, water sports, LSU football, cooking, of course, at Tigers, and eating, scuba diving, snow skiing, flying, and, of course, running. Please join me in welcoming Dr. Trawick today. I'm going to have him introduce the members that he will also have presenting, and Dr. Trawick.
Thank you, Lisa. I appreciate those words. And when she called and asked me to do this, and she gave me the topic, I said, now how many series will this be? And she said, well, it's just one for you. And I said, and how long is the talk? And she said an hour. I said, so in 1 hour I'm supposed to tell them how to set up a medical practice. And it made me think about this picture right here. Does anybody know what movie this is from? National Lampoon. Christmas Vacation. This is Aunt Bethany, for those of you who are too young to know her. And this vision came into my mind when Lisa called me, and she said, you'll have an hour to talk about this topic. And I remembered her giving Rusty a quarter for taking her bag upstairs. And he looked at the quarter and he says, a whole quarter? And that was sort of the way I felt when Lisa asked me. I said, a whole hour I get for this? Anyway, it was a lot funnier when I thought about it. This is my son Graham. And the reason I put this picture in here is, if you'll recall, coming into residency from medical school, you sort of felt like a really little fish coming into a big pond, or at least I did. This was a quite humbling experience for me. By the end of residency, I felt I'm glad to know nothing's changed since I was here. I don't see anyone evacuating rapidly. This is my son also on the same fishing trip. He reeled this bull red in. It took him 25 minutes. And this is sort of how we feel towards the end of residency. But I want you to, I'm going to try to cover some important topics and some mistakes that I've made in starting a practice. I'm going to talk about the pros and cons of solo practice and being an employed practice. I'm going to talk a little bit about the differences and the things that you need to have start working on right now, and you need to have completed by the time that you're finished with residency and starting practice. These are the 4 topics that I'm going to try to touch on today. Talking about a private practice versus a group practice, a multi-specialty clinic practice, hospital-based, or locum tenens. I have a little bit of experience with most of it. I started in private practice for 4 years at Highland Clinic, so it was a multi-specialty group practice. I had these 2 ladies over here that you'll meet in just a moment do a lot of the legwork for me. Somebody asked me the other day what my NPI number was, and I don't have the foggiest clue because they did it all for me. But there's some numbers and some things that you will need to make sure are being processed for. I'm now hospital-based. I've been employed by Krista Shumpert and now Sound Physicians. So I hope to bring you a little perspective on both sides. We're going to talk a little bit about going solo and what it's like to start a solo practice up. There are a lot of people that when you get out, I mean, you owe a lot of money, you have a lot of debt, but I can tell you the biggest mistake that people make are not investing the proper amount of money into a business. If you're going to start a business, you need to make sure that you're putting the investment into that business, or there's a high likelihood that it will fail. A medical consultant has that experience and can share this with you and make sure you're on the right track and getting the things done and processed in a timely manner. Because if, for instance, an insurance company is not processed and you're seeing patients, you're not going to get paid. If you don't get paid, you don't bring home money. If you don't bring home money, your wife is not going to be happy. You need to start probably 6 to 9 months in advance. You need to think about locations. Do you need to remodel? Was this an OBGYN business and I'm trying to put in a private practice pediatric business? You have to think about those type of things as far as remodeling goes. You have to have furniture. Used furniture is fine. When I started at Highland Clinic, they said, we have all this wonderful furniture. I said, well, now I want to order all this. And they said, okay, you can order it, but here's what it's going to cost you. And I said, I really like that used furniture, and I'll take everything you have. You need to start thinking about staff, and we'll talk about that also. And then you'll see a slide in a minute that talks about the different numbers that you need. When I finished residency, electronic medical records were just being dreamed about. So everything we did was on paper. If I needed a chart for a clinic patient, I had to request that chart. It had to come from medical records down to my office. It was a big hassle. You don't have to worry about those things these days. Make sure that you have and are on an electronic health record when you start. It will save you a lot of pain and problems working down the road. So please make sure that you research this and are on a good electronic health record. This can, as a solo practitioner, run you initially $25,000. Some of the better programs are very expensive, but this is something you do not want to chinch on. It will help you with filing your claims. It will help you with your medical records. It will help you with your appointments, and a lot of them will be completely comprehensive and do everything. How much longer is that going to go off, Lisa? This is the same Mr. Machota that used to be here?
Yes, sir.
He should know how to cut that thing off by now. He's been here for a few years.
I'm so sorry.
When you're thinking about billing services and practice management, I also think that this is something you ought to look into. A lot of people choose to outsource their billing and collections, and that's fine, but understand you're going to pay probably 6 to 10% right off the top of that collection rate. They tend to be able to get you a higher collection rate than you would normally get on your own. So sometimes it's worth it. Coding education. When I left residency, after my first month, I ran into our previous internal medicine residency director, Dr. Larry Slay. I don't know if many of you know him, but he asked me how private practice was going. I said, well, probably the one thing that I wish I had more of was knowing how to code accurately. And he said, well, you must have been on pediatrics the time we did that during the lunch meeting, and that was the family practice resident they brought in to teach the internal medicine residents how to code 1 hour. I highly encourage you to get a little bit more formal training, because that was it was a slow ramp up for me. And so the startup costs of starting a practice from day one can run you anywhere from $50,000 to $75,000. And that's why I want to introduce the first person to say a couple of words, and his name is Chris Walls. Chris is at Home Federal Bank, and I encourage you to find a banker that you trust and get to know them well, because it looks very suspicious when you go and borrow $30,000 and then in about 3 months you have to go back and borrow another $40,000. So I highly encourage you to make sure that you're getting the right amount up front, and they can help you with that. So Chris, you want to come say a couple of words about some options?
I'd like to thank Steen for inviting me to come speak with y'all, and it's hard to follow his intro. After I heard his long, she could talk 5 minutes about Steen. He's a wonderful
Can y'all hear him
person.
okay?
Is that better? I wanted to come and introduce myself. My name is Chris Walls. I am a lender with Home Federal Bank's Commercial Banking Division. I've been a lender in our community for the last 13 years, and during that time, I've had the pleasure of working with several residents who have started that transition from going to full-time practice in their given specialty. When early on in my career, I had a customer come see me, and he said he was just finishing up his residency, and he said, Chris, I've got 3 kids, I've got a wife who doesn't want to work when I go into practice, and I have no money. But the one thing that he had planned very well. He told me exactly what it would take to transition into full-time practice. He knew his numbers, and I could see where he was going to be a year, 3 years, 5 years out, and we committed to put this individual in practice. And I'm glad to say 11 years later, he's still a customer of mine, and late last year we closed a piece of real estate for him to have a satellite office and expand his business. If I could leave anything with this group of anybody who's planning to start their practice but thinks they don't have the capital to start it, dismiss that right now. There are programs in place, and banks are willing to put physicians in practice. Bankers will trip over themselves to bank y'all. Secondly, if you do plan to go into your own practice, the most important thing you can have is a plan, and know exactly when you go to see whoever's gonna finance it, know your numbers. Have a good team. Have a good banker, a good CPA, a good attorney. Know your numbers, know what your specialty is. When you come talk to your banker, know what your anticipated revenue should be, what your expenses will be. And I think Steen's done a good job of hitting on that. The number is never big enough. And it's easy for us to say, but when you come to borrow money from me, the worst thing you can do is say, Chris, I know what my number is, it's $50,000, and you come back in 3 months and you say, it's really $250,000, and that still doesn't cover my overhead of living expenses. If we know the number and we can partner with you on the front end, I think there's given a much greater chance of success. Also, I think that it's very important to know who is in the community to help you. We have some wonderful people, some mentors such as Steen, that y'all can visit with and have a good idea, just besides what you're going to Google and find out online or what I'm going to tell you when you come to see my office. Talk to folks who have done it. There's a lot of folks out in our community that were in your seats recently and are willing to offer their expertise before you jump out there and do it on your own. So great things will happen from the folks who sit in this room, and we're here to help. And we also have programs that know establishing yourself in the community also entails purchasing a home. There are programs in place that will offer you an opportunity to purchase a home without any money down or no mortgage interest. And David Barber is sitting in front and can answer any questions later if anybody has any questions. And if you do have any questions, I think he's going to give us a few minutes at the end for a panel discussion, and I'd be glad to answer any specific questions you may have after as well. Thank you.
Thanks, Chris. David Barber is a good friend of mine whom I've known for years. We went to college together. The purpose of this is to remind you, surround yourself with good people. Just as you would do in your here at the hospital, you want to make sure that you've got a good team working with you and people you can trust. This is a transition slide, and this is the backyard of a good friend of mine in Crested Butte, Colorado. This is actually the sun. This is looking west, but it's the sunrise, and it's the reflection of the clouds lighting up. If I could drink a cup of coffee looking at that view every day, I would be very happy, but unfortunately, my banker would not like it if I did that. So I'm going to talk a little bit about the differences between private and employed practice. I'm going to go rather quickly through this. You should have these handouts, and if there are specific questions, I want you to be sure to ask me. It's just not my day. In private practice, we tend to have more of a salary draw, so you have to set that draw. And there are plenty of spreadsheets on the internet that will actually show you a graduated sheet on how to set that salary, predict your patient load, your income. Remember that it may take 6 months before you start having income coming into your practice. Most private practices, if you have partners, you split those receipts monthly or quarterly, and so that's sort of like the bonus, if you will. And then there's very little at the end because you're actually partitioning that money each quarter to make sure that there's very little in the practice to be taxed at the end. Most employed physicians have some type of salary guarantee. There's usually an incentive plan based on production. And how many of you are aware of work RVUs? Have you heard that term before? The work RVUs is a different term, and one I had to learn because I didn't get that in residency. And it's actually a term that's set by the government for each CPT code that we do. And it has a value. And that value is the same no matter whether you're an internal medicine physician or you're a neurosurgeon. It's the same value. It's just that your value per RVU as a neurosurgeon or as a pulmonary and critical care physician might be different than my value as an employed physician in internal medicine. Same code, but you may get more because obviously you're worth more to them as an employed specialist. As I was putting the pros and cons together to try to do a little comparison, I was trying to think of the best way to describe this to you all. And I think that the best way to describe it is a single and married relationship. When you're in a private practice, you can remember back, for those of you who are married, remember back to when you were single. You were the boss. You controlled your own expenses. You hired who you want. You can hire who you want. You sort of made all the decisions, and there was really nobody to argue with you. You just sort of did it, and that's the way it worked. When you're employed, think of it as you're married. And notice my wife is not here today, so I can say this. You're not the boss. She is, or possibly, especially for you men, you understand what I mean. It's a different relationship, but you have to understand that there's good and bad with both. There are a lot of people that don't want to be the boss, and an employed relationship is absolutely perfect. So it may work out wonderful for you if you're willing to let those things go. You'll notice that there are some similarities in both the pros and the drawbacks of this, and they're the exact same. Some people like being the boss, some don't. Eat what you kill is good. I loved working and just making however hard I worked, that's what I got paid. But there's a lot of people who don't want that kind of relationship. They would rather have more of a salaried. As an employed physician, I have noticed that some of the pros is if I had a problem with a nurse or a problem with a receptionist, I didn't even have to take care of it. I picked up the phone, I called Darlene Davis, who was head of our HR department, and Darlene said, I'll take care of it. And that person just poofed, they went away. I don't know where they went. And it was very nice to have that luxury. But some people want that control. Some of the drawbacks are partners. Partners in a private practice, you better make sure that you're getting with good partners because that can make or break what you're doing. You need to make sure that you get along and that you can talk. There's actually a practice in town of physicians that do not talk to each other. They hate each other's guts. And when you see them, they're just the most friendly and nicest people you've ever met in the world, but they do not like each other. And it is I can't imagine practicing in that kind of situation because whether you like it or not, just like in a marriage, there are things that have to be discussed and talked through. As a private physician, that's pretty much the top of the chain as far as advancement goes. Sometimes with an employed model, such as with a hospital, there may be a tract of climbing to chief medical officer or other aspirations that you might have in your career. As an employed physician, there's less autonomy, more red tape to get things done. Sometimes your goals don't match their goals, and that can be frustrating. Again, eat what you kill. Some people just don't like that model. These are a couple of slides just to show you statistics. This was from a 2014 New England Journal article that I found. And if you look at who's employed, men versus women, you'll notice that there are many more self-employed men than women, and also a few more employed men than women. But this is the slide I wanted you to see. If you look at it in age group, what's happening? You'll notice the greater than 40, there's a lot of those physicians still around. But if you'll notice over here look at this, and this is due to the amount of women that are coming out in medicine now. This is a lot of women will tell you to have a family, this might be a good option for you. So just something to think about. Where do employed doctors work? You can see overwhelmingly, I didn't mean to do that. Sorry about that. You can see that the hospital here at 25%, that's the largest employed position. Primary reason for choosing employment: financial security, less risk, and fewer responsibilities, overwhelmingly. You can also see better work-life balance. Sometimes those hours are more set, and you can know in advance that, yes, I can make this sporting event for my children, and it's laid out. In private practice, it's a little bit more difficult to do. What doctors like most? Not having to deal with the business of running a practice. Now I'm going to switch. What do they dislike most? Limited decision making. So you'll notice there are some things that are very similar on both. Not having to deal with insurers and billers, but more limited income potential. So there are some things that are out of your control with being employed, and those tend to be the things that people don't like. Who's happier? This slide sort of sums it up. I mean, you can look at that and tell it's pretty even across the board. So it's all what you make if you make the decision, it's not the end of the road. You can always change your mind later on. But if you'll look, satisfied, employed, self-employed, just about the same. Neutral, same. Unsatisfied, the same. This last column over here, they're not going to be happy doing anything. They should be CPAs or something. Another transition slide. This is my 14-year-old daughter and my wife. We were at Disney about 2 weeks ago and did this is the Donald Half Marathon. And this was after waking up at 3 o'clock in the morning, being on the bus at 4 o'clock in the morning, and going to run the half marathon. So this is about a little after, I guess, 7:30, 8 o'clock, something like that. This was the next day. I did something really, as my wife calls it, the stupid. It's called the dopey, and you run a 5K on Thursday, a 10K on Friday, a half marathon on Saturday, and a whole marathon on Sunday. This slide reminds me that we're fixing to get into something a little bit more difficult. And the difficult part is not running those 4 races, it's carrying 200 pounds around for 4 days on these races and waking up at that hour. And I think that we have an esteemed guest in our midst today who did the goofy, which is the half and the whole. So we were sharing our fun stories of waking up at that time of the morning. This was leaving one of my hospitals the other day and looked over and saw that incredible rain shower as I was flying home. And this is sort of a scary time for all of you. And I don't want it to be scary, but it is. And you need to get serious about it. Because whatever you do, I don't care if you're staying here and being employed with LSU, if you're going into private practice as a solo or group practitioner, or if you're going to be an employed physician, these are some things that are going to need to be addressed by each of you. You need to think about where you want to practice, what city, what type of office building that you want to look at. Who's going to pay for all this stuff? Is it going to be the people that you're negotiating the lease with? Is it going to be the practice that you're going to be going into? Are they going to take care of this? All of these things need to be discussed and put into a contract at the very beginning. These are some numbers slides, and these are some numbers that you may not know what they mean. I tried to list out a few of them and make some definitions here. I brought a friend of mine, Becky Smith, and she is head of credentialing at Highland Clinic, and she worked with me and is absolutely tremendous. Darlene Davis is head of HR, and I'm thankful to have both of you here. Becky, you want to come say a couple of words about you deal with physicians every day, and so you see the problems that happen, and maybe you can talk them through it.
Okay. Dr. Trawick has listed on here, can y'all hear me? He has listed on here the federal tax ID number. If you're going into practice with some other physicians, you probably already have a tax ID number set up. If you're going into private practice, you'll have to get that tax ID number set up, as well as your articles of organization and incorporation. And your attorney or your CPA can help you get all that. CLIA certificates, if you do certain types of tests in your office, you'll need that. Your Medicare, Medicaid numbers, those are very important, believe it or not. Medicare is done through PACOS, and you need your NPI, user ID, and password. And I believe on my form I have a phone number that you can call and tell them that you are the provider and you need your user ID and password in order to set up some of your important numbers. Medicaid applications, Medicaid website has those applications. I'm sure you all probably have an NPI number. There's an individual NPI, and there's also an organizational NPI. If you are starting a private practice with a company name, you'll need an organizational NPI number as well. I'm sure most of you by now have your state medical license, your CDS, your state narcotics, and your federal DEA as well. You may also not be aware that the State Board of Medical Examiners requires for you to obtain a minimum of 20 CME hours per calendar year to renew your license each year. sometimes they run an audit to see if you've done those. Hospital privileges. Are we on to that now? Thank you, Mr. Hospital privileges, it's important to start those early because their processes can be very lengthy in time. It can take 2 to 3 months, verifications of licenses, medical malpractice, your education, your personal references. When you put personal references down, be sure to put someone who will follow through for you because it can hold up your credentialing or
And
even your
pick
hospital.
somebody that maybe likes you too, because I've had several physicians who have applied, and I've gotten really terrible references. And I'm like, why did they pick this person? I mean, I would never hire them after reading this reference. It's good to get, but make sure that you pick someone who likes you.
The hospital privileges, because many of the managed care organizations, they highly encourage you to have hospital privileges so you can admit their patients. These have to go to credentials meetings, medical executive meetings, and finally to the board of directors. So just start your hospital privileges early. Next on the list, we have managed care contracts. If you're going into private practice, you're going to have to request your managed care contracts, Blue Cross, Aetna, United, because your patients are going to want you to be a participating provider with whatever health insurance they have. Some MCOs, acronyms, managed care organizations, they require credentialing before contracting, and then some require contracting before credentialing. It just depends. Let me just put a word of caution out. When a managed care organization tells you you're credentialed through delegation, usually it'll probably be through LSU, your association, you're delegated, when your association with LSU or that delegated entity terminates, so does your delegated credentialing status. So you will have to go through the credentialing process, and that can take 90 to 120 days sometimes. One of the best resources for your credentialing to do a one-time application so you don't get slammed with all these managed care organizations asking you for, I need this, I need this, I need your license, I need your malpractice, I need this. It's called CAQH. It's the Universal Credentialing Database. It's no cost to providers. It's a time-saving tool. Many MCOs access CAQH for credentialing and recredentialing. And always update CAQH with any new information that you get. You get a new license, your malpractice insurance gets renewed. Anything that gets renewed or changes in your practice, if you will update CAQH, and you can do this online, the managed care organizations will not be bothering you to get this information. Or there is the 10-page Louisiana Standardized Credentialing Application, which is accepted by most of the MCOs here in Louisiana as well. Y'all have a thing I sent out that lists, the documents that are required for credentialing. They're pretty standard. You have to have copies of all your education, a CV listed in a certain format. And last but not least, anytime you do any of these things, it's wise to track and follow. When you submit stuff, track and follow it, because sometimes it never gets processed and you're left out in the cold 3 months later and they want you to start all over again. And with all that said, if you choose a private practice, Highland Clinic Management Services offers services for your new practice, such as billing, contracting, credentialing, and much more, to help make your transition easier.
Thank you, Becky.
Thank you.
Appreciate it. If you don't remember a single thing that I say today, please make sure you get those handouts that were there. Highland Clinic provided those. Those are what they use for every physician that comes into practice there. Those are gold. And you'll see there'll be two different ones. One will be a one-page sort of list of documents that you will need for whatever you do. And the second handout that they may be together, at least they got put together, right? Okay, the second handout actually is a checklist of what needs to accomplish with some time frames on when it needs to happen. So those are gold, and thank y'all for sharing those with everyone. Make sure also, I want to comment on this slide, read your contracts, understand what you're signing. I recently had a CEO come and said, we made a small change to the contract for everyone, and I just need your signature here. And he handed me just the signature page. And I said, I need to read the contract. And they said, no, I told you what the change we made, just if you'll sign here. And I said, that's not the way it works. Don't fall for that. There was no tricks, everything was fine. But if you're going to put your name on a contract, make sure you read it. If you don't understand it, make sure you send it to your attorney. It will cost you $100, and it will be well worth that $100 to catch any errors that are in there. All you have to do is just send it over electronically. They'll usually get you a one-page letter back in a day. So if you don't understand what it says, make sure that you have a third party read it and someone you trust. Here's more about surrounding yourself with good people and people that you trust. Make sure you have a good CPA. Ask around, do they take care of other doctors? Physicians are a little bit different than a lot of different people in the way that our earning potential, the way we know how or do manage money. You need to have someone you trust that can advise you on ways to protect yourself. Make sure you have an attorney, especially if you're in private practice, to help you with certain issues around your practice. When you need an attorney, you need one now. And you want to make sure that you're getting the right person. I talked about the financial institution. Also, you want to look at malpractice carriers. Fortunately, in Louisiana, we have a very interesting malpractice system, which I'll briefly talk on in a moment. Lamico is a big provider of private physicians, and almost all of us use Lamico. There are some other entities, especially if you're employed with a company that may headquarter out of state, like Sound Physicians. We use a company out of Louisiana. But understand and get to know your malpractice insurance carrier. We talked a little bit about practice consultants, and also look for a financial advisor. Make sure that you have someone from the very beginning to help advise you on how to manage your money, how to do some things, and make sure it's someone you can trust. Insurance, I put one name up there, Robert Redstone. If you have not met Robert Redstone, you need to meet Robert Redstone. He knows more about taking care of physicians than anyone else, and plus he'll usually take you to Superior Steakhouse for lunch. So I think he's going to actually be talking to you all as one of the institutional grand rounds later on, and make sure you attend that. It will be very helpful and very informative, and I highly recommend getting to know Robert. Life insurance, disability insurance, there are short-term and long-term disability. Short-term can be anywhere from 0 to 30 days of an accident, and then the long-term usually picks up right as the short-term ends. So that's something you need to understand. Make sure that your long-term disability policy has these two words in it, own occupation. If it does not, or if you do not know what that means, I urge you to look into it. But in some sort of a short synopsis of what own occupation is, if I get injured and I cannot do hospital medicine, and I do not have own occupation in my contract, any amount of money that I make doing anything else can be deducted from what I'm receiving on my long-term disability policy. If it has own occupation and I'm doing hospital medicine, I could go and work for the VA and do health screening evaluations from an office. And that money is protected, and I still can receive my disability payments in the event that I'm disabled. So make sure that is in there. Robert will tell you more about that. Health and dental, remember, you're no longer just taking care of you and your family. You also are going to have employees if you're in private practice. Workers' compensation. There was a case that happened not too long ago where a patient came to see a doctor, and you're thinking malpractice. Well, she slipped in the office. That is not workman's comp, but if one of your employees slips in the office, it will be. So make sure you're covered from that. And then business overhead insurance, that's the slip and fall on the patient. Business overhead insurance can run you sometimes $2,500 a year. And then I touched on these three things here with malpractice. Lamico is the Louisiana insurance company. And then PCF. Anyone know what PCF stands for? Patient Compensation Fund. And this was set up by the Louisiana legislature back in the mid-70s, 1975. So I was about 8 years old, I guess, when that happened. And it was because the malpractice insurance rates were getting out of control for Louisiana. So they wanted to make sure that that doctors were able to practice in Louisiana. So this was set up. And then if you leave your practice, make sure that you understand nose and tail coverage. Because anything that, when you go into another position, you have all of these other patients that you've taken care of for years. Within the statute of limitations, they could still come back and sue you, and you're now in a new job. Let's say you changed insurance companies. Who's going to pay that claim? Lamico, if you switch from Lamico to another company, like for instance PPIC, Lamico's going to say, we don't insure him anymore. So make sure that you understand the difference between a tail coverage, which means it's going to protect you once you leave, or either a nose coverage that's going to protect you when you go in. Practice management system, we talked a little bit about, and you can read what they do. Telephone systems. You need to have all of this available in your office. I would urge you, fax machines are sort of getting out of date now. It's much more politically correct to have computer-based software that you don't have to print all this stuff out. Make sure that it also will coordinate with your electronic health record. It'll be much smoother as you move through that process. This is some of the equipment that you will need for any basic office. And then medical records, we touched on a little bit earlier. Electronic records, some have cloud hosting ability that you can access from anywhere. Some are server-based. Think about your transcription cost if you're going to dictate. Voice recognition systems, as well as electronic filing. So when you finish that note on the health record, it automatically drops the claim to that insurance company. Policies and procedures. A good attorney will have all this, but most of these policies and procedures can be located on the internet, and you can get some really good policies to implement. Just make sure you have a book with these policies in place. Personnel management. I cannot talk enough about this. Make sure that you're looking for good people, not Aunt Susie's sister. You want to make sure that you have someone qualified to do the job and someone that you can trust. Make sure you have a very good list of job descriptions for that person and that position, as well as you've got to think about payroll and payroll taxes. Unfortunately, you're going to have some problems with those employees, and you're going to need to know how to handle those very delicately, because sometimes they can turn into some major lawsuits. As far as staff, that first line is one that I have not been good at and have made some crucial mistakes, and I've realized that it's much easier to do it on the front end. So hire hard and manage easy. Make sure you ask the right questions up front. You should hire your staff. Do not have anyone else do it. Do not have your receptionist do it, or your nurse, or someone for Highland Clinic. You hire the staff. You make sure that you're getting what you think you're getting. For a regular primary care office practice, you may need anywhere from 2.5 to 4 full-time equivalent employees. And the quality of your staff will make or break your practice. So don't be cheap. Everyone knows about HIPAA. You want to make sure that you have those forms in place. And to sort of close with, I think you need to memorize these statements. You're going to have patients that are going to come into your office, and they're going to want you to discount their bill, or they're going to want you to, I don't have my copay, I'll pay it later. Make sure you understand that this is a business. If I went to the car wash and told them I didn't have money today, will you go ahead and let me wash my car anyway? They're going to say no. If I show up to pick my car up from the service that I'm getting service done, and I can't pay my bill, I don't get my keys. This is not, I hate to say it like this, but this is a business. This is your business, and this is how you're going to take care of yourself and your family. Oh, and this last one, always blame it on someone else. You don't do anything with the billing. Let them do it. Let them be the bad guys. As far as marketing, you want to start thinking about that as soon as you make some of these basic decisions. So with that, I'm going to close. There will be a time that the sun will set on your residency, and you'll have to get a real job. And it will be here before you know it. And I hope that through this talk that you will be able to have a little bit better understanding. So with that, I'm going to open it up. I'm going to ask my folks to come up and see if there's any questions that you might have. Please feel free to ask anything you want to know. Yes?
Great talk, Steve.
Thank you.
One of the insurance I didn't see on there was practice interruption insurance. My insurance was with my brother-in-law who lost his office after Katrina for 6 months and could not generate any income during that time frame. So that would be another.
Practice interruption insurance. That's a very, very good point. Thank you for bringing that up. I'll make sure I add that in there. So that practice interruption insurance is if for whatever reason, for instance, when Katrina happened down in New Orleans and people could not practice medicine, that can be financially devastating if you're not there. You're not disabled, you just don't have an office anymore. So it can be quite difficult. So excellent point. Any other questions? Anybody, any questions for these folks? I have some information about hospital medicine. If you're interested in it, I'd be more than happy to talk to you about it. If you have any financial information for loans or commercial or residential loans or any for Darlene and Becky as far as practice setup, please don't hesitate to come by and ask. Thank y'all for your time.